My name is Melissa. I'm a physical therapist with Marquette University's Neuro Recovery Clinic. This video is to show you some caregiver-assisted stretching for the lower extremities. The goal would be to do about 3 minutes. That could either be consecutively if the person can tolerate it, or you can break it up into 3 sets of 1 minute. Obviously, if you feel more tight, the more the better. It is important not to go into a point of pain, but just a good stretch. This stretch is to help stretch out the muscle that's on the inner part of your leg. For those who have trouble with this muscle, just simply taking their leg out to the side is going to feel like a stretch. If they need a little bit deeper of a stretch, you can also bend their knee and let their knee fall out to the side. If you're noticing a lot of rotation in the pelvis, to compensate for that tight muscle, you can apply a pressure with the palm of your hand at their hip bone on the other side to make sure that their hips don't rotate. To stretch the hip flexor, or the muscle that's in the front of the hip, first you want to scoot them as far to the edge, close to the edge as you can possible, preferably with part of their butt cheek even hanging off the edge. If they're afraid of falling off, you can do it more at an angle where their shoulders are still on, but then their leg will be off. This leg then just drops down to the side. Sometimes even that is just a stretch. If they need a little bit more, you can give a downward pressure at the thigh or bring their heel slightly behind them. The hamstring stretch can be done by taking the person's leg up onto your shoulder and then straightening at the knee as much as they can tolerate. It's important to not strain yourself by trying to just do everything with your hands and your arms. Use your body, and that'll allow you to give a better pressure. When we do stretches for our calves, we have to acknowledge that there are 2 different muscle groups that make up the calf. So the first one is stretched with the knee straight. So you just come from the bottom, hold your arms in close to your body, lean forward, and give a good pressure through the toes. If you notice that their knee is hyperextending, you can put a small towel roll underneath their knee to protect that knee joint. In order to get the other muscle, we have to stretch with the knee bent. So using a larger towel roll to bend the knee, and then applying the same pressure.